Good afternoon, and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each Wednesday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15, Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email PlymouthInfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today's participants include Kenneth Tavares, the chair of the Select Board, will be delayed in joining us. We have Dr. Philip Triffletti. He is a primary care attending physician at Beth Israel Deaconess. Also Dr. Barry Potvin, and he is the chair of the Plymouth Board of Health and an epidemiologist. Also, we're joined by Dr. Christopher Campbell. He is the superintendent of the Plymouth Public Schools. Stephen Cole is the executive director for the Plymouth Regional Economic Development Foundation, and each Wednesday we're joined by our state representative, Matthew Muratore. I would like to report that this past Saturday, the town of Plymouth enjoyed a very active fall town meeting. Town meeting began at 8 a.m. and it concluded shortly after noon, and town meeting members acted favorably on all the articles, and it was done virtually. And the 126 town meeting members who participated did so remotely along with town officials, and it was participation throughout the town at Town Hall, at Plymouth North High School, and live from PAC TV studios. Now at this time we're going to begin our number 70 forum with Dr. Philip Triffletti. Good afternoon, Phil.
Hi, Steve. Are you able to hear me okay?
Yes, we can hear you.
Okay. Yeah, we're having a little bit of trouble hearing you on the other end. Thank you for having me today. Appreciate being here and going through the COVID update. I always like to start with questions that I get from patients, and I've been getting a number of questions on the vaccine availability for COVID-19. So I'm going to start there. It's very interesting, as Matt often recommends, using the mass.gov site for COVID-19 is very informative and helpful. And I actually went online in the last few days to do some additional research on, how is Massachusetts progressing with its plan for vaccine distribution once it receives the vaccines ultimately from the CDC. And the state of Massachusetts submitted their plan to the CDC, a preliminary plan, last Friday, and you actually can read it online, but I'm going to summarize for you, some of the main points. And, we have our Massachusetts Department of Public Health will be responsible really for putting together our vaccine program. The governor's commission also has an advisory group that's made up of hospitals and other major stakeholders in the state of Massachusetts, and all of them will be, giving input on, how to distribute the vaccine once it's received. And they've described having 3 phases of vaccine distribution. And in the first phase of vaccine distribution, they're anticipating only receiving a relatively smaller supply, possibly in the 20 to 60,000 dose range. So I think initially that's why you'll be seeing a lot of attention on this prioritization schedule. In the schedule that they put together, which is based really on CDC recommendations, their 1A category for giving vaccinations really would be healthcare workers that work directly with COVID-19 patients, doing immunizations in the hospital environment, long-term care environment, skilled nursing facilities, emergency medical system, like your first responders, ambulances, et cetera. So that would be the first wave. The second wave would be looking at other essential workers in other industries besides healthcare, looking at those over age 65, as well as individuals with high-risk medical conditions. And then they anticipate that, once the supply is ample, that we should be able to, get the vaccine to people of all age groups and health status. So that's basically the Massachusetts side. When I went back and looked at what's happening on the national scene, I think many of us were familiar with the term Operation Warp Speed, and that's actually being spearheaded by our Secretary of Health and Human Services, Secretary Azar. And what they've done actually is sign contracts with 4 major pharmaceutical companies to guarantee delivery of 100 million doses from each of these companies. And so right now, I've been trying to find, would anybody commit to a timeline as to how many doses and when? And I think, people are very probably reluctant to commit to a timeline, but I think you may have heard recently in the media that Moderna and Cambridge and also Pfizer, they're hoping to have emergency use authorizations from the FDA in the next month of November or December, where they actually could start to deliver dosages to the CDC, and then the CDC could distribute them to states. So, I think we're getting much, much closer. I did see one media report in Reuters, which mentioned a very ambitious goal of having 40 million doses by the end of the year and 700 million doses ready by April. But I think that type of speculation, we're going to have to wait and see how well we can execute that plan. I think it's a great plan, but I don't know how fast we'll actually be able to execute that. So we'll see. It is possible that eventually you might even see vaccines trickle down into primary care offices. This is part of the plan, but I think you might also see more centralized distribution from major sites designated by the Department of Public Health. So there'll be more to be learned about that as time goes forward, but I thought it was worth the update. Just a couple other quick notes. There have been some media reports, I think, about airline travel that look very encouraging. Both in terms of the risk of spread when you're in the airline cabin, it appears that some of the studies they're doing, the air exchange is great. And so it seems like the risk of spreading infection with airline travel seems to be much less. And then there's also some studies looking at wearing masks in airline cabins to reduce transmission. That also looks to be extremely effective. So it looks like airline travel may actually be, much safer as we're gathering more data. And I think that's an encouraging thing. I think it's worth mentioning to continue to emphasize, if you listen to Dr. Fauci, Governor Baker, one of our biggest risks going forward is the gatherings issue and trying to minimize family gatherings for the holidays, for Thanksgiving and Christmas and other holiday type celebrations. So I think that we have to really try to resist the temptation to, have larger gatherings indoors, especially without masks. So, I'll make a plug for that going forward. As you probably know, the trends in Massachusetts, our numbers are going up, unfortunately, from our lowest numbers. Also in other parts of the United States, there's starting to be more serious issues with, major spread in the central United States, in the northern states. So our national numbers now are up to about 60,000 new cases per day. Our peak in July was 70,000 per day. So the United States as a whole is doing poorly. We're not doing quite as bad here in Massachusetts, but we really have to adhere to all these mitigation strategies as best we can to try to, avoid further problems. Also, if you're following it globally, there's a big acceleration now in Europe also. So, this so-called second wave, I think that people have been predicting, it does look like we're on the upswing now. And I think we're just going to have to be that much more careful in all the things that we do to try to prevent spread. Obviously, the more serious consequences of more infections are hospitalizations and deaths, and those numbers, as probably trail the actual numbers of infection by several weeks. So it will be several weeks for us, I think, to see the full impact of what's happening both here in the United States and across the globe. But we'll be monitoring that very carefully. I think as far as therapeutics right now, still the studies, tend to indicate that while we do have medications that will shorten your illness, they don't seem to have an impact on the outcome in terms of death from the infection. So, we still have fairly limited therapeutics to help people when they get infected. And so for that reason, I think it just gets back to, prevention is really, the main goal right now is, we have to try to just avoid being getting this infection. And so my last part I want to go through is what I want to call the let's be honest segment. So first thing about being honest is, I think it's pretty obvious, but I just want to say it publicly. The president has been a bad role model for safety behaviors, and so I think that's good to keep in mind. That having large gatherings like he's doing with campaigning, that he's had at the White House, the lack of real emphasis on masks. I think we have to continue to promote this publicly to all of our communities, that we don't want to follow the president's behaviors or recommendations on these issues. I think in the media you've seen some mention about herd immunity without the vaccine, and we should forget about that. I think all experts feel that's a very bad idea. It could lead to millions of deaths in the United States. So I don't think that will happen. I think our herd immunity is going to come through vaccination. That's really the only safe way to do it. We'll continue to learn more as we go, but we have really shown that masks are very effective in preventing spread. I've talked about that on previous broadcasts. In some states like Arizona, when they had a big uptick in cases last summer, and then people started wearing masks, they put in some mask mandates, they closed bars and did some other mitigation strategies. These things seem to help bring them down from their peak level. So it can be done. I think we can do it in all of our communities. We just have to continue to adhere to all these recommendations. I think when it comes to the economy and the effect of COVID on the economy, I think the primary thing, the way I look at it is, if we can control COVID, that will allow our economy to do better. And so that's how I'm hoping people will approach this. And then the last thing I'd like to just say is that when it comes to the vaccine, the distribution and the production, I think it may take a little longer than it's hoped for, but we'll see how it all plays out. So that's what I have to do to start today. And then of course I'll be happy to take any questions later and final comments. Thank you, Steve.
Dr. Philip Triffletti, he is an attending physician at Beth Israel Deaconess. And Dr. Phil, since we're being honest today, I just want to say that you and your wife Lynn have been very gracious in recent years, inviting my wife Noelle and me to your home on Thanksgiving. But this year we will not be tempted if you do invite us, and we will not be coming to your home for Thanksgiving. But thank you for your presentation and your suggestions. And at this time we're going to be going to Dr. Barry Potvin, and he is the chair of the Plymouth Board of Health, and I know he has quite a bit for us today. Good afternoon, Barry.
Hi, Steve. First, congratulations on a really well-run town meeting. Thank goodness all the important articles were actually passed and funded by the town meeting. I didn't get to see all of it, but from what I did see, it was quite impressive. The things I'd like to talk about today is mostly going to involve our designation as a red or high-risk community. I'm going to give you some figures and calculations that show you where we are and where hopefully we're going to be going. I also want to mention that there's been a lot of concern lately that the nationwide death count, which I believe is something like 220,000 at the moment, is actually probably quite an underestimate because those are deaths directly caused by the COVID-19 infection. It doesn't count the people who are indirectly being affected by this and dying from other conditions like diabetes, heart attacks, Alzheimer's. There's also more substance abuse going on. So there's also a lot of psychological stress factors that are entering into this. And they feel that the actual true number is probably more like 300,000 and likely to become 400,000 by the end of the year. Those are kind of scary numbers, but that's probably closer to the truth. One way to get this down a little bit is to make sure that people understand, and I'm sure that Dr. Phil can support this, people should not be avoiding medical care and diagnostic trips to the hospital or to their local doctor's offices because those areas are being very carefully controlled. The chances of getting a COVID infection in those settings are virtually zero. And you certainly can't delay medical treatment and screening procedures when they're available and when they're needed, because it puts you at risk from other diseases that may be equally problematic and possibly could cause long-term harm or even death. So I imagine Phil will have something to say about that later on also. I did recently, as a matter of fact, I was just on the meeting that was being held that's slowing down Ken Tavares from joining us with the COVID enforcement and intervention team. So there was a large group gathering today. It's being attended by Ken at the moment, along with Melissa, the town manager, and a lot of other people and a lot of state officials to talk about various ways we could increase enforcement activities. There's a lot of useful information being shared. I jumped out of the meeting to get to this one. Ken is staying at the other one, so I can't talk about the contents of the meeting at the moment. I do want to show you how we're doing in terms of what's going on with COVID and the new things we've discovered about it. If I can try and share my screen to show you some information. Let's see, yes, I think I can do it. Let's see if this works for me. Can everyone see this? There's a bunch of pie charts here. Yes, okay. So what I'd like to show you here is this is being done by Margaret Cohen, our Department of Public Health Office. It's very helpful. She's extremely good at this and she seems to enjoy doing it. And so usually if I ask her to do one of these with specific information in it, I'll get it back within a matter of hours from Margaret. So the things we want to emphasize here is what's happening with the shift in the ages of the people that we see getting positive tests and infections from the COVID. So if you look back at August, you notice that the 21 to 30 age group, which is the gray one here, and also the 31 to 40 age group, which is the orange one, you combine those two and it comes out to be about 19% of the total positive cases. Then when you look at September, you notice a big change. So now these two groups combined come out to be about 40% of the cases. And this is only a partial month figure over here, but you can see again that if you combine these two, you're seeing 43% of the cases coming from this particular age group. So we're very concerned about this age group. We need to find out where are they getting this from? Why are they becoming infected at larger numbers? They may not be as ill. They may not be going to the hospital. They may be asymptomatic and pre-symptomatic. So it may not put as much stress on the hospital as we might have worried. But nonetheless, they are capable of infecting others in large numbers, and we think that's what's going on. If you look a little further down on this, we did something else. So we wondered, okay, well, if it's these age groups, how is it split up between male and females? And if you look at 21 to 30, you see that it's split about evenly. Then you look at 31 to 40, and you see 67% are now male and 33% are female. And if you combine them, you notice it's still 60% male and 40% female. So this is an issue that also tells us where we have to target our enforcement efforts. And the enforcement efforts need to be aimed at wherever, mostly male, but some female too, members of these particular age groups seem to be congregating in large numbers, probably without wearing masks, probably too physically close to each other, and are probably transmitting the disease among each other, and then they're spreading it when they go home and when they visit other members of the family or friends. So we're looking at that. Of course, we're concerned about things like restaurants that are really mostly bars, where these people may be congregating in large numbers late at night. To look at the red and high risk categories, I showed all this at the select board meeting, so if you're watching that, I'm sorry I'm repeating it, but I'm doing this because it was requested and there may be many people that didn't watch it on the select board meeting last night. The red designation requires for Plymouth about 68 positive cases over 14 days, and that results in an average daily case rate per 100,000 population of an 8.1. Anything that is 8 or below would be yellow or green. So if you look back at our data for the last couple of weeks, this is the data that came from the 27th of September through the 10th of October. It showed up on the map that was published by the state on the 14th of October. So here in Plymouth, we had 95 positive cases over those 14 days, gave us a daily case rate per 100,000 of 11.3, which places us solidly in the red zone. That didn't mean we're already high risk, because in order to declare us high risk, we have to be in the red zone for 3 consecutive weeks. So we were red the previous week, map before this, which came out on the 7th of October. The most recent one, which is actually not going to be out until later on today, from the 4th to the 17th of October data, shows that Plymouth had 91 cases that were positive, results in an average daily case rate of 10.8. So we are still, when the map comes out today, going to be a red community again for the 3rd week in a row. So now we are officially, according to the state, a high-risk community for transmission of the COVID-19 virus. That enables us to access a lot of state resources, which you'll be hearing about in the near future, and which I know they're talking about even probably still now at that meeting that's currently going on. The new data, which is going to be for the map that's going to be published a little bit later on the 28th of October, we already have 10 days of that data out of the 14. We have so far seen 52 positive cases. If that rate stays that way for the entire 14 days, we're probably looking at something like 73 new cases for an average daily case rate of 8.7. Better, but still above 8, which means we're still going to be red for the 4th week in a row. How do we get out of this? Well, we get out of this if we can not be in the red category for 3 consecutive weeks. Once that happens, we can go back and start doing more of the reopening guidelines that for the moment we're not going to be able to participate in because we've been red for 3 weeks. The main changes involve indoor performance venues, which are not going to be allowed if we were still in the yellow category and not red and not high risk. They could have opened at 50% capacity. That includes places like Memorial Hall and the Spire Center. So they are going to be delayed in opening. They're not going to be able to do that. Restaurants, we're going to be able to have 10 people per table. Now they can't do that anymore after Wednesday, which is today. So they got to go back to 6. They were going to be able to have bar seating with plexiglass shields protecting the bartender from the customers. Again, because we're high risk, they can't do that. So there's going to be no bar seating allowed. There's a few other things that are going to happen, which most of us probably don't much think about. But fitting rooms were going to open. They are not going to be able to open. There's going to be some changes there were going to be changes in indoor gathering sizes, which were going to be going up to 50 from 25. Now they're going to stay at 25. So there's a few other things. They mostly involve just slightly increased capacity limits at gyms and some other indoor gathering spots like libraries, which we're going to go from 40% to 50% capacity. Now they stay at 40%. So that's a general summary of what's going on. So we're looking at what on earth can we do that we haven't already been doing. Again, that's mostly going to be based upon help from the state. We're looking at other things. And I wanted to show you one other thing that can be screen shared, which we're talking about doing here in Plymouth. So Julie, if you can put up that other picture from the Washington Monument, if you can find it. So there is something called the empty chair demonstration, and I guess Julie can't find it, but basically at the Washington Monument, they set up about 2,000 empty folding chairs on a lawn area. Each of those chairs represented about 100 people who had actually died from the coronavirus infections. And it was striking. It hit you right in the heart. You can't possibly ignore that. Let me see if I can get that up for you myself. So let's see if you can see it. No, there it is. Can you see that? That's visible. So I doubt very much if anybody looking at this would not say, oh my gosh, I mean, this is a striking, horrible thing to have to see. where each one of these chairs has 100 people who have died in this country since this pandemic started. Well, we don't have that many here, but I'm going to stop the share and go back to this. But we have had 76 people who have died in Plymouth. Fortunately, the numbers of deaths have not been increasing much at all for quite some time in Plymouth, at least not yet. So we're talking about actually the possibility of setting up a similar sort of scene in front of Town Hall with 76 folding chairs with a large banner in front that points out that these are all people who are no longer with us, that can no longer share holidays, including Thanksgiving, with their families and friends. And they're going to be all deeply missed. But obviously, we have to resolve to try to keep those numbers from not going up any further and doing anything and everything we all possibly can do to try to get this pandemic under control. It's going to take some time. It's not going away. The numbers are going up this fall. There's no doubt about that. They probably are going to continue to go up for some time. So it's going to be a difficult, challenging time for all of us, but we have to do everything we possibly can. And that includes, if possible, because of the private gathering and local private parties that have been going on that are sources of infection, to make sure that if you see them, you let the police department know about it. You let the public health department know about it so that we can intervene and try to stop those kind of gatherings from happening before it spreads to a lot of other people. Chris is here, so he's going to be talking about what's happening in the schools. Almost all of the people that we see infected that are school-age children are undoubtedly getting this not at the schools, but they're getting it from their home environment where someone else in the family has been previously infected. And once they're infected, they can very easily pass it along to all the other members of the household, both young students and also older individuals that may be living there. And Ken, I'd like to also support you in your decision not to share Thanksgiving with your family members, except those that live in your same household. We will be doing the same thing, my wife and I. It's going to be a little lonely for us, but we'll do it anyway because it's the safe thing to do. Jerry Levine, who is the vice chair, is going to be doing the same thing. It's a hard thing to do, but it's probably, hopefully, only going to be just 1 year. And we can deal with that if we have to, just to make sure that everyone possibly stays safe who possibly can. So I have a lot of other things, but I don't want to take any more time and I want to leave time for questions. So I'll stop there. So thank you, Steve, very much. I'll be able to answer any other questions that come in online.
Thank you. That's Dr. Barry Potvin. He is the chair of the Plymouth Board of Health. He's also Professor Emeritus from Yeshiva University, Department of Biology. He's an epidemiologist. And yes, Barry, this Thanksgiving, the food may not be as good when I'm not traveling over to my brother's house, but we're going to do what we need to do to be safe and socially distance. Dr. Potvin also mentioned about some of the other hidden effects of the coronavirus, substance abuse being on the increase. Again, we've also talked about physical abuse. Abuse protection petitions and harassment protection petitions have increased during the pandemic, and we'll continue to talk about that in future weeks when we are joined by Sarah Cloud, Director of Behavioral Health, and Dr. Russell Fry. At this time, we're going to move to Dr. Christopher Campbell. He is the Superintendent for Plymouth Public Schools. Welcome, Dr. Campbell.
Thank you, Steve. Thanks again for once inviting me back again to this important program. I want to start by addressing what has been on the minds of many people in our community we're talking about, which is the positive permutation in our community. Dr. Potvin has already mentioned Plymouth has been designated as a red community. As a school department, we wake up every day, we go to work every morning, and we do everything we can to keep our schools safe, first and foremost, as well as to keep our schools open. That's our goal, but safety is always our #1 priority. We've had students and staff reporting presumptive, pending, and positive COVID-19 cases, and this will continue as we operate schools during a pandemic. We're working very closely with the Department of Public Health to confirm, contact trace, quarantine, and then notify the school community. We're taking extra steps for transparency, including not only updating weekly confirmed case totals, but also issuing notification school letters and details about each case while still respecting privacy, of course. It's important for the community to know, I believe, that there is no one threshold or not one metric that indicates a school or a district should suspend its in-person learning. Our administration is working very closely with the Department of Elementary and Secondary Education's COVID reporting unit, where there's a positive case in the district, to determine the appropriate next steps. Follow-up steps can include implementing existing Department of Education protocols to notify close contacts for testing and isolation, conferring with local public health and the Massachusetts Department of Public Health to determine if transmission is occurring in a class or school, or seeking advice on whether to suspend in learning for a particular classroom, particular grade, or a particular school. It's important to note that these decisions need to be made on a local context and occur in collaboration, great collaboration with Department of Education, our local public health department, which has been outstanding. And to date, as Dr. Potvin already suggested, there is no evidence to suggest that transmission is occurring in a classroom or in a school. It is happening externally, and we're having, that's the experience that we're having. I'd also like to take a moment to mention our COVID dashboard, which we're operating for several weeks now, trying to be very transparent with our data. Sometimes there may be a discrepancy, and the community may ask themselves questions regarding our data. So there may be a discrepancy between the number of cases posted on our dashboard and the number of cases that we reported to staff and families through our school notification letters. The data on our dashboard has been confirmed by the state through the Department of Public Health's MAVEN online information system. So this is when it gets to our Department of Health, Public Health Director's MAVEN system. So in addition, we immediately, with any case that is brought to our attention, report through letters to individual school stakeholders. We report the cases to public health, and we're doing everything we can to get that information out in a very transparent, yet ensuring the privacy of our stakeholders. So please note that there may be time between the letters sent and the state's reporting of the Plymouth Public School cases in MAVEN, but we're being very transparent with that data. We also have a portion of our dashboard which reads the number of students currently quarantined due to exposure at school. So that word, we've been talking about this recently, due to exposure at school. This may be a bit confusing too, so I'd like to clarify this data point, which we published. These are students that are being quarantined due to close contact while at school. So close contact is considered any individual that comes within 6 feet of a positive case for a period of 15 minutes or more. So an example of this in our case would be a student that rides a bus and is within 6 feet of another individual during that bus ride. So in an effort to help reduce the spread within our town, we are working very collaboratively with the town of Plymouth, with the Center for Active Living and the Chamber of Commerce to promote a positive social media campaign. Our district has been working with the town to try to develop a mask wearing campaign. One of the aspects of this is going to be the installation of a temporary wall at the skate park with posters that have been designed by our own high school students. Some of these students will be installing the murals themselves. So this is part of a larger social media campaign that we're doing in collaboration with the town. This event, this installation will be happening tomorrow, Thursday, October 22nd, starting at 6 p.m. We're also looking to do more of this campaign, such as putting a possible installation of another mural at Forges Field. In addition, our education television staff and program are working on 2 videos for this campaign. One is a simple yet eye-catching typography style video that will introduce the campaign and then can be easily shared. And the video we plan on pushing out this Friday following Thursday's kickoff event. So in closing, I want the public to know that our students and our staff are doing a remarkable job and continue to work very diligently and practicing our primary prevention strategies in school. And it's critically important, that we continue to practice these important prevention strategies outside of school, as Dr. Potvin has already said. So I encourage anyone, if you have any questions at any time, please contact your school administration, our director of health services, or my office. We're never too busy to take a call and to clarify anything that people may have questions on. So thank you, Steve.
Thank you, and that's Dr. Christopher Campbell. He is Superintendent, Plymouth Public Schools. All of our panelists could be answering your questions. You can send them to us at plymouthinfo@pactv.org. And today, once again, we're also joined now by Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome back, Steve.
Thanks, Steve. Hi, folks. Last time I was here, I said that Plymouth is very strongly situated for an early recovery. And Steve said I could come back and say, I told you so if I was right. Well, I'm glad to say that, we have seen some positive recovery in our unemployment numbers. In fact, I'm pretty encouraged by what we've seen. In April, unemployment in the town of Plymouth reached a high of 18.7%. We stayed above 10% until August. And as I said, we've seen some positive trends. Our September unemployment was down to 8.7, and we just got our early October numbers, which are showing at 7.8. And the state of Mass went from having the highest unemployment rate to being at about 9.6. So as I said, we do see some positive trend recoveries in the unemployment sector, but we still have some places to improve. And I want to remind folks that there are still 3,000 members of our community who are not recovered or who have not yet fully recovered their positions. That's a little bit alarming because that's actually double the actual numbers we saw at the start of the year when our unemployment rate was closer to about 3%. Also just to share with some folks, about 51,000 jobs in the county were tied to the PPP. I want to encourage folks at this time to start to think about the types of jobs that they want to have. I want folks to start to think about the types of jobs they want their friends and their family members to have. I want viewers to start to think about the types of problems that they've encountered during this time and the solutions that they came up with. That's the foundation of a new business, folks. I know right now doesn't feel like or seem like the right time to start a business, and I won't argue, but I understand the apprehension. And there are several things that are playing in our favor right now, and I'll just quickly go over them. First and foremost, the labor market is freed up a bit. That obviously happens when there's higher unemployment. Small business owners have access to a talent pool that didn't exist prior to COVID. And a number of small business owners here in town told me that one of the biggest impediments to their growth was actually finding qualified, reliable employees. About 325,000 cars passed through Plymouth during commuting hours prior to COVID. 22,000 Plymouth residents were commuting someplace else to go to work. And as people are returning to work, they're rightly asking themselves if they want to continue to drive to or through Boston again. People want to work closer to home, and starting a business in Plymouth can be an advantage because you have a well-educated and qualified workforce right here. And we have about 3,000 folks just in our own town who are looking for jobs. Secondly, home occupation zoning bylaws are very generous in Plymouth and in our region. In most cases, you can start a business right in your home and you don't need a permit unless you're interested in putting a sign in your front yard, for example. So you already have access to an office. That solves your space problem. And then third, a new business has an open forum right now in the marketplace to communicate their message. Usually it's difficult for new businesses to cut through, or any small business, to cut through some of the noise and reach your customer in normal times. Well, the most relatable analogy I can come up with at this time is to encourage folks to walk through any mall. Dawn of the Dead had a more active mall than most of the malls in our region right now. So that gives a pretty good example, I think, of how crowded the marketplace is right now with people as well as businesses. Now's a good time to take your idea and start that business plan. If you don't know where to begin, please give me a call. I'll be glad to help where I can and put you in touch with some folks who can help fill the gaps. Even if the time is not right now for you, be ready and stay healthy because recovery is happening. Thank you, Steve.
Thank you. And that is Stephen Cole. He's the Executive Director for the Plymouth Regional Economic Development Foundation. He'll be here with us for our next round when we answer questions. You can send them to plymouthinfo@pactv.org. And every Wednesday, we're joined by Plymouth State Representative Matthew Muratore to give us an update on the state of the state response to the coronavirus. Matt, welcome.
Thank you, Steve. And again, congratulations on a very successful town meeting done remotely. I was able to watch some of it, and it was really well done, particularly the opening ceremony for the 400th commemoration of Plymouth. It was nice to see you in that pilgrim get up along with the Plymouth Guard and other folks. It was just nice to see that we can still be creative in a time like this. So,
Well, Matt, I think
thank
you were in the opening ceremonies too, so that may have been a reason why you enjoyed it. And
yeah, that could be too. I wasn't going to mention that.
but
yeah.
thank you for arranging for the governor to join us at town meeting.
Yeah, the governor was thrilled to actually do that. Obviously, the governor wanted to be here for the 400th commemoration that was going to be happening, in April, and obviously because of the pandemic could not be. So he was tickled pink that he was able to do this at least, and we'll be back down here at some point when it's going to be safe. So he was very pleased to do that. So with that, I want to just first of all congratulate and thank you all the members here today. You have gone through my checklist already, so I'm going to be very brief. We talked about vaccine distribution, which is what I had that Dr. Phil talked about. We talked about phase 3, step 1, what Dr. Potvin talked about, so that's checked. And Steve talked about the unemployment numbers, so that one is checked. So let me just give you just a quick overview of the numbers here in the Commonwealth. Total individuals that have been tested are over 2.5 million people of individuals tested. We are approaching close to 5 million tests that have been done. So that 2.5 represents 37% of the population of the Commonwealth that have been tested as individuals. To date, we have 142,295 confirmed cases since the beginning of this, with 9,537 confirmed deaths. 67% of those deaths have come from the long-term care community. As was indicated, the 7-day average of tests have increased to 1.3%. We were as low as 0.8% a month ago, so it is on the rise, but still relatively low. The hospitalizations are at 517 folks confirmed COVID in hospitals in Massachusetts, with 94 of those in the ICU and 35 on ventilators. Here at BID Plymouth, they have 24 confirmed or suspected cases of COVID and 0 cases in the ICU. So this just goes to go to what Dr. Triffletti, Dr. Potvin were talking about with regard to the age groups that we're seeing, and people aren't getting as sick. It's a younger population, but we believe the hospitalizations will be on the rise shortly. Deaths could be on the rise as well. So we do need to see the program that the superintendent is talking about putting out there, and the director of the health board and the health board itself. Education is going to be the key to this, particularly that age group between 19 and 39. With the state, the vast majority of the increases that we're seeing is the same as we're seeing in Plymouth, 13 to 39 in unregulated social gatherings, and that's where it's happening, and that's where we need to target. In the last thing is last couple of things. First of all, Plymouth County has reached the 10,000 mark with cases of COVID. Plymouth County is 10,786 and have 806 deaths at this point. And the only other thing I do want to mention is the unemployment was at the lowest in decades at 2.8 back in February. And as Steve indicated, it's now at 9.6, which is still well above some of the records that we hit back in 1990 and in 2010 as well. So we are seeing some movements, though, in the right direction. But as Dr. Phil said, I'm going to steal this line and use it wherever I go. I liked it, is that controlling COVID is good for the economy. And that should be our tagline here in Plymouth and here in the Commonwealth as well. I think people can equate the health of their loved ones with the economy. And I think people would, maybe they'll start wearing the mask more and be cognizant of what they're doing. So that's my update for today, Steve.
Thank you. That's State Representative Matthew Muratore. You can send your questions to PlymouthInfo@pactv.org. We're here each Wednesday. Next Wednesday, we have quite a panel joining us. Once again, Dr. Mark Wilson. He is a Plymouth resident and epidemiologist. Karen Keene, she's the Director of Public Health for the town of Plymouth. Joseph McDonald, he is the Plymouth County Sheriff. We will also have a representative from the Plymouth Public Schools for our school education segment. Michael Jackman is the district director for Congressman William Keating. Heather Cosby is local CPA. Michelle Brady is director of Elder Affairs. Amy Naples, the executive director of Plymouth Area Chamber of Commerce. But now we're going to go back to our panel, and we're going to begin with Dr. Philip Triffletti, attending physician at Beth Israel Deaconess. Phil, what else do you have for us today, and what do you want us to remember?
Yes, I have 3 more points I want to make. And the first one, with Dr. Potvin's comment about, don't delay needed treatments or screenings. And, I saw the same data that Dr. Potvin's referring to, which is when you look at the 220,000 deaths in the United States in the past several months during the COVID pandemic, it is believed that, when they try to calculate other deaths, there could be another 100,000 deaths of people who didn't go to the doctor or the emergency room for a heart attack or a stroke or other problems. And I've certainly seen this in my medical practice. I have to continually encourage people when they call me, if it's something I feel I have to see them in the office for that might be serious or that they need to go to the emergency room. People have been, I think better about that still compared to, back in March and April. It was very difficult to get people to go. But, I think we have to continue to mention that you have to continue with your regular care. If you're sick, don't hesitate to go to see the doctor or go to the emergency room. It is true that your risk of catching infection in these places, the infection control practices in our medical offices and our hospitals are excellent. And I do think the risks of infection by going there are really minimal. So, if you do have medical needs, you should definitely take care of that and not hesitate and not worry about it. You don't want to have something bad happen that could have been, treated more aggressively or prevented. So that was a great point Dr. Potvin made earlier in the broadcast. The second thing I just want to mention about how we're doing here in Massachusetts, I actually have a patient and friend who's a state official, and I was talking with him this morning about how good restaurants have been in the state of Massachusetts about performing all of their infection control procedures in terms of social distancing, wearing masks. And he basically said 94% of the restaurants in Massachusetts are doing an excellent job on this. So I'm really proud of what's going on in Massachusetts. I think we have a strong culture and society here to try to protect one another. As many people have said, we're all in this together. And so, we just have to continue to do that. And as we've emphasized, I think a lot of it has to be done with the more unorganized gatherings that occur, with groups of young people or families, and just continue to hammer away at that, try to get people to avoid doing that. And then the last thing, in regards to Stephen's Thanksgiving plans, I just want to say that, I do love my brother, and I love my brother's family very much. But most certainly he was not invited to Thanksgiving this year. So I just wanted to make sure that was clear.
Good for you, Phil. I was just going to say, yesterday I was at your hospital for a routine checkup, and all that you say is true. They had sanitizer, and we were asked questions, and masks are available for those people who don't have them. That's Dr. Philip Triffletti. He's an attending physician at Beth Israel Deaconess. And at this time, we're going to go to Ken Tavares. He's joined us. He is chair of the Select Board for the town of Plymouth. Ken, this really is an opening statement, and we'll come back to you for a closing statement. But Dr. Potvin told us quite a bit on behalf of the Plymouth Board of Health. What do you want to bring to us as you begin today?
We just completed a very successful meeting with the state. It was requested upon turning red. I can pass on to Representative Muratore and to the other members of the state delegation that there's a great deal of information that's available to municipalities. The Commonwealth is sharing it. We had, at least from my perspective, I had at least 6 good takeaways that I'll discuss with Dr. Potvin, the Board of Selectmen, and others that are involved. I'm very confident that we can work our way from the red category. The Board of Health has, and I have them in front of me, a number of suggestions that hopefully we'll be able to implement. The police chief was in on the phone call, as well as Dr. Potvin, the health director, our town manager. So I think that there's a lot of information that's being put together that's going to help us, get back into a more acceptable category. And I'm optimistic that we will do it.
Thank you. Kenneth Tavares, he is the chair of the Select Board for the Town of Plymouth. We'll come back to him after we go through the rest of our panel. We're now going to go to Dr. Barry Potvin. He is the chair of the Plymouth Board of Health. Barry, what's another takeaway for today? You've told us quite a bit in terms of some of the changes we'll be seeing at restaurants and at stores. What do you want us to remember?
There's a few things, actually. I'll do it as quickly as I can. With regard to private parties, you have to try to restrict yourself to members of your own household. If it's not possible to do that, you'd rather have other members, other friends, and other relatives that don't live with you at a gathering, then the only way you can probably do it safely, if you're going to involve eating and drinking, is to get tested yourselves before you gather together, to make sure that no one is an asymptomatic carrier or a pre-symptomatic carrier that might unfortunately spread the disease to everybody who gathers at the party. So the bottom line is, please, please, please be careful, whether it's Halloween or Thanksgiving or Christmas. We have to be aware that there are people that are asymptomatic, that feel fine, but may be capable of transmitting this infection to others. With respect to something Steve mentioned about people commuting back and forth, please also remember that as you do that, if you carpool with people who are not members of your immediate household, it is a really significant risk. You're in a very small enclosed environment. You're probably not going to be wearing masks. And again, if anybody is in the car with you who is a carrier of that virus, you probably infect everybody who's sitting in the car with you on the way to work. And with respect to things that Chris Campbell mentioned, just think about what happens when those children are in buses, although they are physically distanced in the bus. Yes, a student in a bus with other students could be exposed, but remember that all the students in the bus are all wearing masks. All the students that are in a school, even if they're nearby somebody who's later found to be positive for the coronavirus, they are all wearing masks as well, and they're all physically distanced. Those two things can drastically reduce the chances of getting infection spread, even if there is somebody nearby who actually was infectious. So be careful of that. Finally, I came across this one little app that was just put out by the Brown University School of Medicine. It actually allows you to categorize how much risk there is involved with anything and everything you might be thinking about doing. And I'll just read it to you a couple of times so you can look at it yourselves. It's pretty simple to do. It's called mycovidrisk.app. And you can look at that. Again, it's mycovidrisk.app. All you need to do is put down what kind of activity you're thinking about, whether it's indoors and outdoors, the number of people you think may be present, and whether or not you think most or all of them or none of them are wearing masks. And you see this little dial go up, and it can either be moderate risk, low risk, high risk, or very high risk, just so you know what you're doing and what the risk may be entailed in doing so. Finally, just please cooperate as much as you can. We need all the help we can get from everybody in this town. We are working as hard as we possibly can, all of us that you see on these shows, to try to control what's happening and to make sure that the town members can stay healthy and our business and economic community can thrive. Thanks, Steve.
Thanks. Dr. Barry Potvin, he is the chair of the Plymouth Board of Health. We're now going to circle back to our education segment. Dr. Christopher Campbell, he is Superintendent of Plymouth Public Schools. Dr. Campbell, your closing thoughts.
Thank you. I just want to say that we've had such a strong partnership with our local Board of Health, Department of Public Health, and the Department of Education and our school physician. I just want to thank each and every one of you, each organization, for the tremendous support, and I think it's demonstrating success on our end. You know, we know as a school department that we are under a microscope, and social media platforms follow the reopening of schools and provide their own commentary, but please know that we are focused on what is best for our community, our students and staff that enter our schools each and every day, and we will continue to do everything we can to be transparent and diligent in our practices, while also still respecting the privacy of our staff and students and families. We will share our school conditions through personal phone calls, school notification letters, our district website, and other district social media platforms. And I encourage the public to view our social media accounts for the most reliable information. You know, how long we keep our schools open will really depend on all of us as a community, as everyone has said today in the show. Our staff and students are doing a remarkable job following primary prevention strategies in schools, and this is demonstrating success. It is equally important outside of school. We need to continue social distancing whenever we can and always wear masks when we cannot. Families need to continue to keep their children home when they're sick, and we're so appreciative of the families who are doing the right thing every day by monitoring their children for symptoms, seeking medical assistance and testing when children show symptoms, and notifying our schools of the situation. We care about every child, every employee, and all of our families, and none of us want anyone to become sick. So we will continue to focus on what is best for our school community, our staff, and our students that enter our schools every day. You know, the safety and well-being of our staff and students will always be our #1 priority. And again, I just want to thank this community and very much appreciate Dr. Potvin's support, the Board of Health, Department of Public Health, for the tremendous work. And if anyone has any questions, again, please reach out to your administration, our public health, our nurse leader, or my office. Thank you, Steve.
Thank you, Dr. Christopher Campbell, Superintendent of Plymouth Public Schools. Next week, our education segment will feature Carolyn Rains. She is the Director of Health Services for the Plymouth Public Schools. We're now going to Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. Steve, what's your takeaway today?
I just want folks at home to know that the Foundation Board of Directors is working really hard, toward medium and long-term solutions to strengthen our small business support systems as well as our economy, to diversify it. With a $200,000 grant that we were able to win through a competitive process with the US EDA, Economic Development Administration, we're studying the feasibility of creating a center for entrepreneurship. These things will have professional offices, conference rooms, hacker space, maker space, tinker space. They're nuanced, but they are different. 3D printing, a ghost kitchen for commercial food preparation and pop-up restaurants. These are the things that will help bring ideas to concept and prototypes to the marketplace. The Foundation Board of Directors wants folks to know that we're working very hard to make sure your investment in Plymouth is met with a reinvestment. We're doing everything we can to make sure that when you start a business and run a successful business in Plymouth, you have good, meaningful partners. I'm very proud of my board. We have two of my members here today, Ken and Matt. Amy Naples is a friend to the program. She's also on our board. I just want to say, we have spent countless hours trying to conceptualize ways that we can create activity in the marketplace, because from that activity, we can then get economic development. So we recognize the road ahead is long. It's not quite Sisyphean, though, based on the information we had from Superintendent Campbell, Chairman Potvin, Doctors Phil, and there's just no shortage of every effort right now, all hands on deck. And I guess the last thing I'll leave folks with is, remember, good health is good economics. Thanks, Steve.
Thank you, Stephen Cole, Executive Director of Plymouth Regional Economic Development Foundation. We're going to go to State Representative Matthew Muratore. We have a question. Matt, viewer Stacy asks if the state would be putting up a drive-through COVID tent that would not require a referral from a PCP. I don't know if this is a question you can answer, but it was posed to you.
Well, I think I mentioned on this show last week, Steve, that I was working with the town manager and the chairman of the board. There is a program the state has, and we've been working with the county on a location off of Oberry Street, and we're just waiting to hear word where that stands. There's also another program, which is Stop the Spread program. I'm sure Chairman Tavares probably spoke about that and Chairman Potvin at their meeting earlier today as part of a state initiative now that you're in the red too. So there are programs, we'll work with the town on what they want to do and where they want to do it. But I think you'll start seeing that coming soon.
Thank you. And a closing statement?
Sure. Well, first of all, I want to thank Steve for his leadership on the Plymouth Economic Foundation, and just the ideas you have, Steve, have been amazing. And we are going to be helping more and more of these businesses, these small businesses. So we appreciate what you're doing. And Dr. Potvin and you and the board and the director, Karen Keene, have been tremendous resources for all of us. And you know, you really didn't sign up for this when you were appointed to this, but you have all stepped up tremendously. We have a great deal of confidence in what you're doing and what you're providing. We really appreciate your leadership. And the same with the schools too. Dr. Campbell, you know, you didn't sign up for this either when you were taking this over, but you know, it is what it is. The teachers have been fantastic. Your administration's been fantastic. You know, the parents have been fantastic. And it's just, you know, the school committee deserves a lot of credit. I said this the other night to them during the school committee meeting. They didn't sign up for this either, but everyone is just stepping up and doing a fantastic job. And we really appreciate the leadership that you're all providing, along with the select board as well. You know, one of the things that we do as a family is, you know, we have a large family that lives in our home, but one of the things we do with our extended family, like Easter, we actually do Zoom meetings on important days. So on Thanksgiving, we'll be Zooming with people that we usually get together with in our family and do a Zoom just like this. And it works out well. We put it on our, you know, big screen TV that we have in the living room, and everyone gets to see everyone. And you know what? It's the next best thing to doing that. So I'd recommend to people doing a Zoom Thanksgiving if you can. And last, I think, you know, controlling the COVID is, you know, obviously good for our health. It's good for the schools. It's good for the economy. And I think if we all keep working together, we are resilient people, you know, that we will get there. We're not that far off. We are in the red now. It's going to take a few weeks to get out of it, but we should start now, working together to get out of it so we can improve our health during this COVID and our economy. Thank you, Steve.
Thank you. That's State Representative Matthew Muratore. We're now going to go to Kenneth Tavares. He is chair of the Select Board. And Ken, as Matt has said, when you and I first decided to run as a town official, we also didn't sign up to be responding to a pandemic, but we're doing it. And what do you have today for us as we close out this segment?
Very simple message today. Each one of us can make a difference. It's up to us and what we can find within. And with that attitude, with a positive attitude, we will change our category that we're in. As I said earlier, I'm positive that will happen. There are many valuable tools available to us between the Board of Health, the other elected officials. We'll be implementing a number of changes in the next week or so. I want to say thank you to everyone. I know every time we try to do a thanks, we miss someone, but not only to the people on the panel, but the people in this community that are concerned, and they are making a difference, one person at a time. Thank you, Steve.
Thank you, and that is Kenneth Tavares. He is chair of the Select Board for the town of Plymouth. Thanks to all of the people from our panel who participated today. We'll be coming back to you next Wednesday and each and every Wednesday at 12 noon to provide an update as to Plymouth's response to COVID-19. I'm Steve Triffletti, Plymouth Town Moderator. Good day, and thank you for joining us.
Have a good day, everybody.